Hey guys, today's on schizophrenia, baseline versus acuity. Schizophrenia and baseline versus acuity. But before we get to this distinction, please allow my brief prelude. As you know, I've conveniently recorded it for our mutual comfort, our mutual convenience, and our mutual luxury. And hey, I've been around a lot of preludes in my ears, and this one is particularly luxurious. Kind of like a, red shag carpet or a full mink. Both very luxurious.
Hello there, my name is Robert Francis. You've stumbled on my Unconquering Schizophrenia YouTube channel.
Pull the old
Where
switcheroo.
me and the bird.
No bird, just a bird.
That's right. We talk schizophrenia.
TESC.
This is the cut of my jib right here for reasons of my medical confidentiality. I'm a licensed clinical social worker times 15 years. That's a lot of gabbing and chatting.
Way too much.
I've been diagnosed with schizophrenia for a score 5 and 1. And that puts a little gray fleck in my beard.
That's 26 years.
Thank you for joining me on my channel. Now to topic.
A score 5 and 1, huh? That's 26 years. A score is 25 and 1, 26 years. A score 5 and 1. I don't know if that's entirely pinpoint accurate, but it's close. The semiotic is a long time. So in the psychology world, they have a distinction of baseline versus acuity, and it's good to know the difference. Baseline is where you want to be. That's your usual functioning self, your stable self, your most asymptomatic self. That's your usual self is your baseline. Conversely, acuity is when you get, you may be triggered, or you're in a heightened state of psychiatric presentation. You may be disturbed, you may be having acute symptoms, you may be having a deluge of symptoms, and that would be an acuity. And of course, the goal is to get yourself back to your baseline. So if you get triggered and you're in an acute state, the whole goal is to get back to your rational baseline. And so it's kind of like a graph where you acuity is like a spike, and then baseline is like a flat line. So that's the clinical distinction of acuity versus baseline. Acuity is when you're having a deluge of symptoms, and baseline is your usual normal, highest functioning, kind of stable sense of self. So baseline versus acuity. And the whole goal for anybody is to dwell more in the baseline rather than distressing acuity. All right, so you get the picture. All right, so what else? TESC at the very bottom. When I first did the cover, they forgot to put it in there. I put it in my design. I designed the cover of both books, and they didn't put it in there, so I had to send it back to them, and they put it at the bottom. The TESC. I call it TESC, the Essential Schizophrenia Companion. It's the companion. It's not the companion, it's the companion. Call this one TESC. And then the namesake, right here, I call OCS. And I did the cover for this one, too, and it was supposed to be a hopeful message. Probably took me 2 months to just do the cover. But I think they came out good, don't you think? All right, guys, that's it for acuity versus baseline. I got to go back to my baseline and chill out in my baseline, and that's it for today. Thanks for joining me. We'll see you next time.